All right. Welcome. My name is Leora, she, hers, based here in the East Bay, California. It is 12:30 my time, so thanks for hanging out for a lunch conversation on policy with me. If you are joining us, you are here because you're interested in learning about school mental health policy from some fabulous human beings from across the country. And you're here for round one. I feel like this means we should do a ding ding. Round one, ding ding. And round two is an hour after this ends with different folks. So if you are a hungry policy caterpillar, I did say that on recording. If you're a hungry policy caterpillar and you'd like to join us for more, you can come back for round B at 3 p.m. Pacific time. But in the meantime, I'm going to take a breath because I'm very excited and I'm just saying hello. And I would love if you in the chat box can share with us your name and your role and one thing you're looking forward to from this time together. The name and role and one thing that you are looking forward to in this time together, panelists included, peer teachers included. So if you are just joining us, again, I'm going to do a warm welcome to our National Training and Technical Assistance Center for Children, Youth, and Families School-Based Services Policy Learning Forum. And this is a peer learning space for teachers across the country. And I say teachers as in teachers with a little t, folks that we can learn from and learn with, to share with us how we are thinking about policy design and construction and really thinking deeply and intentionally and listening into both celebrations and also challenges. So a very warm welcome. I'm going to walk through a couple introduction slides and then we'll get into our learning space. And I very much encourage you for folks in the room to put your name and your role and one thing you are looking forward to learning in this session. And it could be, I have no idea what I'm looking forward to learning, but the lineup looked great. Welcome from Minnesota, welcome from New York, welcome from Tennessee, and a hello from me here in Oakland. Okay, beautiful. Thanks, Carrie. We can move ahead. This is funded by, we're so grateful for funding from the Substance Use and Mental Health Administration. And I want to note that all of the opinions and teachings expressed today are ours and ours only, both of the TA Center and also of those who are presenting. Welcome, Dave. Welcome, Sarah. Welcome, Susan. This is a Zoom meeting, which means we are very much asking for some self-awareness and regulation on the Zoom front and to stay muted when you are not speaking. And the best way, you're seeing some slides right now, but we'll be taking down slides for the conversation. The best way that I like my screen set up is in view. If I click on view and I'm side-by-side speaker. So I'm seeing both the PowerPoint and those who are spotlit on the right-hand side. But again, we'll be taking down the PowerPoint so we can be centering the listening when folks are up on our screen. You also, of course, have reactions. So if you're hearing something that really resonates, you want to throw up a rainbow, a sunflower, a stem of grapes, please do that. Yasmina is throwing up a sheep, I believe. Please do. There's also live transcript happening for accessibility for closed captioning. If that feels distracting to you, you can always click out of it. And Carrie is here for any technical support. So if you need any support, you can private message Carrie and Carrie will help you get what you need. Also just wanted to name that because we're not in Zoom webinar, we are going to be watching questions and comments in the chat box. So if there is, when we get to Q&A and there was a question that we may not have caught or we aren't surfacing that you feel really urgent about, definitely raise your hand and that will come up to the top and we'll be able to hear from you directly. Welcome from Maryland, welcome from Idaho, welcome from Oregon. We're so happy to have you all. I want to remind a quick reminder that all of our sessions in this series are recorded. So today we're doing 2 sessions and then on Thursday we're doing 2 sessions. All will be recorded so that you do not have to experience School Mental Health Policy Forum FOMO, fear of missing out. You will be getting all of the recordings. And we are also going to be capturing the learning from these sessions and then sending out to everyone who's registered. So multiple modalities of learning. I also wanted to note, and you should have gotten this from me this morning. If not, I'm dropping it right now, that we created a learning guide to help process all of the richness, all of the golden nuggets that will be coming up in our time together. So that is in the chat box, and that again is for you to download or make a copy of, not to write into, to help you track your learning. I know that I usually need it when there's so much richness happening. All right, I'm gonna just quickly pause and check in with Carrie to see if I missed anything on the tech end.
We're all good.
That's what I like to hear. Welcome from Texas. All right. If you are new to us, the National Technical Training and Assistance Center for Children, Youth, and Families, we're entering our second year, pew, 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 right now. And we are funded by SAMHSA to support bringing out the systems of care approach, this idea that children, youth, and families are most supported and served when systems are in alignment, in coordination, and that we see young people not just for the behavior they're expressing or the need that's surfacing, but who they are in the rich ecosystem that they walk this world through and with. So we are a very large partnership, and that's for the next slide, a really large partnership of incredible human beings, from Youth Move National to help us center youth voice, Georgetown to help us center early childhood development, Texas, University of Texas at Austin to help us center folks with lived experience, and Fredla, family experience, Change Matrix for equity. There's so much. I could go on and on and on, but this is who our constellation is. Myself, Leora, and Yasmina, who are co-moderating, and Carrie, we work for the Center for Applied Research Solutions. And that is the longest introduction for me to just do a moment of welcome. Hope that this sky image brings some expansion to you wherever you are in your day. We want to invite you into this learning so that it feels both rich, but also digestible. And want to remind you that we are here to support any of your needs getting met. So if you missed something and you need support, if you are needing help with tech, we're here for you. And the other reminder is that whatever comes up, whatever learning comes up in this space is exactly the learning that needs to happen in this space. My next reminder, and I'm going to ask Carrie to also help me, is if I'm hearing a little background noise, so if you're not muted, please have self-awareness and mute yourself so that we can center the conversation in the room. Okay, beautiful. If you've not done so already, feel free to say hi in the chat box, who you are, your role, and one thing you're looking forward to in this learning. And that will really help us in this conversation. Welcome, we're really glad you're here. We did that already. Let's move ahead. Okay, taking a moment of both acknowledging where we are, both literally on this land, literally in this moment, and in this moment in time. For many of us, it's August 24th. For many of us, we either have started the school year or starting the school year. We are in many different phases of grief and healing in our own personal and professional lives. I'm going to take a moment to name that oftentimes in conversation around policy, it can feel very here. And actually what we're hoping that even if there's just one takeaway from a conversation about school policy, but it's the this that guides the this. So inviting you, if you haven't already, to just take a breath. If that helps you feel regulated, it helps me. And it also helps me remind me where I am and who I am, because there are many Zooms that we're on all day and meetings that we're on all day. And so nice moment to just go, oh yes, I'm here to think about how we can design or dismantle or co-create policies that can really ensure equity for ourselves and those that we love. Let's move ahead. Okay. So hopefully you feel a little bit more grounded and a little bit more oriented. We are about to move into a section of laying the foundation. There might be some of us who are totally new learners, some of us who are policy practitioners, but we want to remind you whether or not you're here live with us or you're listening to the recording, we want to just provide a little bit of a framework. Then we get to listen to our peer teachers. We've got folks from across the country, cross roles. I hope you can see the big smile on my face with how excited I am to be in learning. And then we'll go into next steps. Before we do that, I'm going to launch the poll. So you should see a poll in front of you that will pop up. And that can also help us know who's in the room. So some of you are advancing wellness and resilience in education grantees, and that's the way that you're approaching this conversation. Some of you are real beginners to school mental health policy. Some of you got your degrees in it. You could be on this panel. We hope you might in the future. Some of you even attended our April primer that Yasmina and I and Matt and Christy, we led in April. And we also have the session reviewed, the session materials posted. So I'm planning to get a couple more folks. Feel free, peer panelists, also to answer too. So again, if you are another school mental health initiative, you might be a safe and supportive schools. You might be also known as S3. You might be Safe Schools Healthy Students alumni from way back in the day, or you might be many other initiatives, part of the COIN initiative, etc. Okay, I'm going to wait for a couple more folks, and then looks like we're almost all there. So I'm going to end the poll and share the results, and just to let us all know who's in the room together. So we do have a good amount of folks who are advancing wellness and resilience in education, school mental health champions from this latest cohort. And we also have folks who are joining us from other initiatives, which is beautiful and good for the folks on our panel to hear. And it looks like the majority of us identify as beginners in the conversation, with some in intermediate and advanced. And we really invite you that if you hear a question that you have a response to put it into the chat box so that we can be in vibrant learning with one another. And we've got a couple of folks who are with us in April and reviewed. And if you weren't there, also okay. That's why you're here now. Beautiful. Okay, let's move ahead. Okay. So today, part one is the foundations for the foundations. So some of us, because of the context of our work, we often feel pushed or forced or called into getting into the what before backing out and really being grounded into the why and maybe even the how. And so part of what we're hoping today is to lift up conversation, both in part A and in part B later today, in what are we even talking about when we say policy? What are we even talking about when we say co-designing policy? Many times policy is both an outcome of organizing or has been written separate from those that it's impacting. And how might we grapple with that relationship? And then that last question, which can be a little scratchy for some or exciting for others, for me it's exciting, which is how do we interrupt or modify historically injurious and trauma-inducing policy? And even in that question, there's an assumption that we have to acknowledge that some of our policies historically and right now are relics of past belief systems that need to be examined. So that's what we're hoping to get into today. Okay, so Yasmina and I are going to do a little bit of a back and forth here, and then we'll get into conversation. We want to be really clear. And if you were with us in April, you heard this again, and I feel totally okay with saying it one more time. Because every time it's like a reminder, a call to action. So this is the framing of this conversation today, later today, and Thursday. So I'm going to do the first one, which is the school mental health policy. And again, these are not only explicit policies about school mental health, but we're inviting us to realize that, for example, special ed policy is school mental health policy, that teacher retention policy is school mental health policy, that we actually want to broaden the way that we're even defining what school mental health policy is, because in the end, it's about health. but actually that policies are ways in which both the collective health of our humanity and school systems and school sites and districts and systems can be centered. So ultimately it's about health, and I hope that we're in agreement that now is really a prime moment to center our individual and our collective well-being.
It's also about anti-racism, and some folks also use the word equity. We use anti-racism to talk about that action, and more than just sitting on the sidelines, knowing that our policies are not neutral and that trauma-informed policies are not neutral. And part of our work is to help parse those things out.
Yeah. So again, just want to remind, as you're hearing these, if you're like, ooh, that's a big statement, or ooh, that brings up a lot for me, feel free to put it in chat or to track that, to track where you're feeling your heartbeat a little bit, or your eyebrows furrow a little bit, or your head nodding voraciously. The third assumption that we're lifting up today is that this conversation is about sustainability, ultimately. Ultimately, this work is not about me, it's not about Yasmina, it's not about you as an individual, but the policies hold up structures of the house, as Isabella Wilkerson wrote so powerfully in CAST last summer. And so part of our encouragement as school mental health champions is to think about, what do we want to live on, and what is living on that should not be living on in this moment in time.
And for me, the next one says accountability and safety, but if I wear my former hat as a state leader responsible for safety, I think this is especially critical for us as mental health professionals and leaders to help folks reimagine what safety is and what safety looks like. And if our message can be that safety is much more than fences and bulletproof glass and doors and safety drills, and that research demonstrates that safety is actually much more about how school feels and the connections and the positive relationships with adults, that's mental health policy as well.
Policy is also about making the implicit explicit. So that's what we'll be asking our peer teachers to name. Policies give language and give us direction. And so we have a saying, and you may have heard me say this before, that a policy is an externalized belief system. And so that can both be an organizing tool, it can also be a data tool. So it's the implicit explicit.
And finally, it's about organizational, I'm going to say self-care and community care. When you are open with your organization, with your stakeholders, and with your community, and you're offering that transparency, you're creating investment in a future together. And that is what retains staff, that is what brings in community members, and that is how you amend policies that have historically not included all of the voices. By caring for each other and starting internally as an organization with caring for yourself.
Yeah. Okay, so those are our it's abouts. Curious in the chat box, and invite our peer teachers to chime in too. Which of these it's abouts is like resonating super fiercely for you, and or is there another it's about that you have that is driving you to center policy as a tool for equity, a tool for creating actual systems of care? So just want to see what comes up for folks. Which one is like heart throbbing right now? Do you have other it's abouts? Yes, okay, so Laura's heart throbbing for it's about sustainability. Yep, we've got one who's saying, yes, Amber, it's about accountability and safety, health and anti-racism. Yes, okay, beautiful, beautiful. Yeah, thank you. And the acknowledgement, it's about accountability, right? We know too much for us to continue the way we have. And Greg, hopefully you'll speak more about that. Yes, and we strongly believe, and we say organizational self-care, we say self and collective care. Part of the question is, how do we policy, not just for the individual, but the interdependent collective?
I love what Evelyn wrote as well.
Yes, disrupting the school to prison pipeline. Yep, that as part of that dismantling. Okay, beautiful. Let's move ahead so that we can actually get to the talk. Okay. you may have seen this before. I think it's important to do a little bit of a pressure point here, which is that I'm just going to mute. Okay, perfect. Which is that policies, again, are tangible outcomes. They are surfacing of belief, values and belief systems and cultural and situational context. So we know that there are some policies, and did we not learn the most this year, that there are policies that are able to be taken down, dismantled, or created with the quickness when there is a cultural or situational context that opens a window. So I just want to acknowledge there are many of us who've been championing for school mental health, for trauma and resilience-oriented care, for anti-racism as an integral part of trauma-informed and resilience-oriented care and crisis recovery for years. And this moment, this collective moment, this last 18 months, opened the context for policies that we may have been organizing for, laying the foundation for, to be able to bloom, blossom, and take place, right? So part of our work when we're in this conversation that Tamika, that Kim, that Maribeth, that Laura, that Greg, that Pamela, that Yasmina will bring up in the next hour is to actually go to not just the outcome, but more about the values and the belief systems and the cultural context of schooling that can both enliven and also interrupt some of those outcomes that have created harm or are fostering healing.
And as we move on to the next slide, and I'm going to be really brief here because I know our peer teachers are going to get into this a lot more. When we talk about policy, we can think about it in a couple of different ways. You have the legislation that comes down from your state or federal legislation, and then policies can be anything from your organizational policy to your classroom policies, procedures, and practices. And then regulations are those things that come down from like your Department of Education or from the regulated entities in your state, like the State Medicaid Authority, that say how you're allowed to bill for certain services. All of these interplay together to create our practices, and it's important to understand which we're dealing with when we go to create or make change.
Thanks, Yasmina. Okay. Let's get into the conversation. Let's hope you can sit back and get ready for a good conversation. I've got my water and coffee next to me. We're going to move ahead and be in conversation. So our peer teachers for this hour, join us of course for the next hour. Our peer teachers today, and I'm going to invite you to come on screen as I say your name, are Greg Peters, Kim Gwynn, Laura Ficara, Maribeth Barney, Pamela Trevetti, Tamika Gregory, and Yasmina Luxinger, and I'll be moderating. We have a very rich multi-paradigm dimensional systems acronym degreed group of folks to be in conversation. So I'm going to invite Carrie to strike the PowerPoint and center these incredible human beings. Hello, hello. Hi, everyone. And what I'm going to do first is to invite folks to, and this is the order, to introduce yourselves. You can go off mute, introduce yourself, and one way that you are connected to school-based or school mental health policy. So Greg, you're up.
Great. Hi, my name is Gregory Peters. I go by the he, him, his pronouns. I'm the director of the San Francisco Coalition of Essential Small Schools. And even after 2+ decades of being a teacher, a principal, and now a support or running a support organization, my connection is actually through my son, a child with PTSD who has a 504 plan, and this serves as perhaps my greatest lens for the work that I do.
That's you, Kim. I'm not going to prompt you. So we're going to go Greg, Kim, Laura, Maribeth, Pamela.
Okay.
So Kim.
All right. Hey, guys. I'm Kim Gwynn. I'm actually here in Tennessee. I'm the Aware Director in Cocke County Schools. Yes, I said the word Cocke. And I have actually been with the first cohort of Aware. So how I've got involved in all this is through the mental health processes that we're working in Aware.
Hi, everyone. I'm Laura Ficara. I'm the co-coordinator for Project Aware in New York State. I am perhaps most importantly a teacher by trade, both general ed and special education. I've taught the gamut K-12 and preschool. I have some experience at Head Start. When it comes to policy, just now my lens is that of a state leader. However, I always let my experience as a teacher guide those endeavors. Thanks.
Hello, I'm Mary Beth Barney from the New York State Aware Project as well with Laura. Laura and I work closely together. And I am also a teacher originally with my background mostly in special education. I also have some graduate work in school psychology and educational administration as well. And for me, policy almost always goes back to the educational administration piece and understanding the importance of policy being available within districts and the groundwork that it sets for everything that the schools do, really. It's great to be here with you.
Hi, I'm Pamela Trevetti. What a pleasure to be here with these wonderful colleagues. Amazing. What a privilege. So I've served in clinical roles as a school psychologist and infant and early childhood mental health consultant. And I also had the chance to work on federal policy with colleagues in government for a decade. Currently, I serve as the infant and early childhood mental health team lead here in our TA center at NTAC. And like Gregory, I feel like my most important lens is being a parent of an elementary school age kiddo with behavioral health issues. I've just recently returned to clinical work and I serve as a consultant to kind of local schools here in the DC area through my appointment at Georgetown. And, you know, I feel like when I'm doing this work with teachers that just started on trauma-informed, brain-based approaches, I'm preparing them to work with kids like my son and to sort of work on themselves to build their capacity to come to this work with children in kind of focused on restorative practices. So I'm really excited to be both in kind of a national training and technical assistance role and to do this more individual work with schools and teachers again. And I, you know, it's my son and kids like him that I always think of when I'm working with teachers.
Hello, everybody. My name is Tamika Gregory. I serve as the Project Aware Director of Connecticut County in Alabama. I think I feel linked to this type of forum. I'm also a school counselor and I have a mental health background, so I'm a licensed therapist. So policy has always been a part of pretty much what we do. In regards to school-based policy, I think it's important because as stated before, it's building that ground and foundation of what's needed and what can be implemented to make sure that we're servicing these children. I feel very passionate about this work. I am also I have a family member who suffered from mental illness. I have a niece that I raised as my daughter, and she really struggled in high school. And I just think what services could have been provided for her if we had other interventions and policies in place. She's doing well now, and that's great, but I think, you know, it's so important to just have those factors in place. And so I always think about her, you know, when we service children who are in need, because it's such a great need. Thanks so much.
Thank you, Tamika. All right, last but not least, Yasmina.
Hi, my name is Yasmina Luxinger. I am the School-Based Services Transformation Team Lead for the National Training and Technical Assistance Center. But the lens that I am bringing you today are that of a mental health professional by training, educator by accident that fell in love when they ended up as a school-based mental health professional, drank all the Kool-Aid, and have worked at every level of education up through state level leadership. And my former position was the Director of School Safety and Social Wellness for Arizona Department of Education. In my purview included Project Aware, school safety program that put counselors, social workers, and school resource officers into classrooms, as well as emergency response for the pandemic, and a couple of other CDC and fun things that they throw in there. And we were in the Division of Equity and Diversity and Inclusion, which I absolutely believe is related to mental health access and ending the social determinants of health.
Yeah, thank you. So, okay, hope y'all are as excited by the voices in this room. And we also know that every single person in this learning space, both now and also if you're listening to a recording, that you equally are your own expert and your own wisdom with what brings you to the policy practice. I wanted to say from the jump that we're hoping for this to be a vibrant conversation. So if you're listening and you're like, oh, they interrupted each other, or oh, they chimed in, that was the norm. There was welcoming for that. This is supposed to feel like a living room conversation. And the other piece is that this is not intended to be this is how you do it. This is intended to be voices of experience with challenges and celebrations, to just really validate and affirm that this work is hard. And policy is really complex work, and it should be, because it has incredible impact on the lives of our colleagues and of the lives that we love, our young people. Okay, so let's just take one, back it up. We saw that there are some folks who are beginners in this work. I know I'm a learner when it comes to school mental health policy. I think if you say a word so many times, it becomes like policy. Like, what are we actually talking about when we say policy? And so I'm hoping that Mary Beth, Laura, Kim, Pamela, and whoever else wants to chime in, how do we even talk about school mental health policy across different roles? From your perspective as a nurse, Kim, to at the state level, Mary Beth and Laura, how do we make this thing of school mental health policy up here feel real and also get people on board to do the work with us? So opening it to Mary Beth, Laura, Kim, and Pamela to start, but opening it to whoever else would like to chime in.
So I'll jump in. I'm the old person, as you can tell. And so I always equate, or I always think that it's rather important for people to understand that in the educational system, policy is really where it's at. It is what empowers everything else that happens in a school system. And I know the word can be used loosely these days, but well, probably always, actually, not just these days, but it's important, I think, to understand that when you're working with schools or in schools, the way that you can really tell the level of commitment and involvement is if there is an appetite to create good, sound policy. Because whether you're in a school or a district, you could have a wonderful leader who is implementing all kinds of things. But you know what happens to those initiatives and that great work when that leader leaves? It's not, if it's not grounded in a policy that's been approved by the school board, it becomes unreal unless you are fortunate enough to have another leader come in and continue those initiatives. So it's a really extremely important mechanism in the school, as it kind of is in our governments, no matter what state we're in, to have a well-written, thoughtful, collaborative. It's got to involve, I mean, good policy really involves everyone who is a stakeholder in that community or that district, to really give some good thought and dedication to creating policies that are student supportive and non-biased, and will be carried out through procedures that are also supportive of the intent of the policy.
I have to agree, and not only because Mary Beth is my close colleague, but just because that resonates with me, certainly in my current role with Project Aware, but also as a teacher. When we think about policy, the way I see it, especially in New York, where policy is very much guided by district level decision, is that the policy set up the systems to make our programs, our practices, our procedures sustainable, so that exactly what Mary Beth said happens doesn't happen, right? That we're not linking excellent work to one specific champion, which is amazing to have, but how do we sustain those efforts, innovate those efforts, and grow those efforts? And that's really where I see policy being important, no matter what lens we bring to the table.
So I wanted to chime in as well. You know, I've had different hats, as many of you have as well, but as a nurse involved in hospital administration, policy looks a little bit different than it does in the current educational facility that I'm in now. And so for hospitals and for healthcare, you know, you don't do a lot with policies. You know, in healthcare, it's more about task and how to at that local level. For instance, like the only time that I was ever involved as a hospital administrator for policy was really to look at a dress code some 20 years ago, 30 years ago, when we started seeing lots of tattooing, lots of piercing, lots of colored hair. And then that's when we went away from nurses all wearing white into now wearing scrubs of different color to denote what department you worked in, whether it was x-ray or labor and delivery or whatever. But now as wearing a different hat in an educational facility in Tennessee, we find ourselves with, you know, like the slide earlier showed that our policies are based on the laws that come down from our legislatures. And in Tennessee, we have a Tennessee School Board Association that writes policies for the district. And then when it comes down to the district level, the district is responsible for mostly doing procedures and protocols. And there's not a lot of input from the time that it leaves the law until it gets into the school district. But I'll give a caveat to that. There can be lots of change from the bottom up. So when we look at students and communities and parents and advisory councils that then go to the school board, the local school board, and say, hey, you know, we really need a policy about this or that. They are very apt to listen, and we can edit or go back and change some policies. But mostly in Tennessee, it's guided from the top down, but we can change from the bottom up. And I really want people to understand how important youth voice and how important advisory committees are in changing policy from the bottom up, and it can be done.
I appreciate what you're saying, Kim. You know, when I first saw this question and this topic, I reflected on that word policy, and I was really stuck because I see it in two different ways, and I think it's playing out in these responses. And I think that when we unpack that word policy, at least in my experience, I have found the go-to reaction is to think about the policy from the top down, and to think about the state policy and the district policy, and to use that, unfortunately, as reasons why we can't fill in the blank. And what I know to be true is that even though we have to live in a system and try to navigate that system and influence that system from the bottom up, as you're saying, there's also a lot of policy that's in our control. Every classroom teacher has policies. Every school has school-directed policies. Every school I walk into, I know some of the policies based on my walk from the front door to the office. I'll never forget the school that I walked into, and by the time I got to the front office, I saw at least 20 plus signs around the halls that said, absolutely no sunflower seeds. Now, I knew something had happened with sunflower seeds, but the state didn't vote on that policy. And so my question is, how are we creating cultures that can have the lens, that can have the priority, the anti-racist priority, the critical race lens that we want our legislators to have. So yes, we want to be fighting upward and influencing upward, but we've got enough to keep us busy as well and ask ourselves, how are we grading? How are we pushing kids out of our class? How are we celebrating or not celebrating? What's the sense of belongingness from the very policies that we have in our control and, quite frankly, often in our authorship? And I think what you all are suggesting are ways that we can do that. How much are we including the voices of our students and our families in the policies that are in our control? I remember when I changed as a math teacher, when I changed my grading policy to be standards-based at a time that people weren't doing this, we met with the families every single month to introduce the curriculum with them, to go through the curriculum and to get their feedback around how pushing for mastery was going to play out and how we could change the narrative even at home, so that it wasn't, did you get an A? But it was, what did you learn? What do you know how to do, etc. So I want to keep that mirror up as we're pushing. We've got to simultaneously be pushing up as much as looking inward.
Yeah, I'm so grateful, Greg, that layer of how do we do the both and because there are many folks like, I think, Tamika, Kim, Laura, Mary Beth, who working for systems where there is a level of, there's a constant tension with how much space do I have? And I think that's a essential question with our policy organizing. How much space do I have? How much safety do I have? Where might I be brave? Where might I need to be a little bit more patient? I mean, there's so much organizing that goes into the relationship between bottom up and top down, which is a language I welcome folks in the chat to help me out with, because I always have struggled with that power relationship. But I want to go to Pamela before we go into exactly that question of how do we co-design student and family educator policy, to hear from the early childhood perspective of how do y'all talk about policy? What do we need to learn?
Yeah, no, thank you. I think, and I what Leora and Greg and Gregory and Kim were articulating about sort of the back and forth between the macro and the micro. I think that we've seen that play out in early childhood also. I think a driving factor, was, and this is also influential to sort of thinking about how it unfolds for older kids on school-based policy, was the science of brain development and what happens during the critical developmental period of 0 to 3, and what happens when that development is disrupted and the brain architecture changes for kids who are exposed to, traumatic stress. And sort of, I think a lot of the justification for early childhood programming came from thinking about that and being mindful of sort of communities that were particularly at risk for experiencing that level of traumatic stress. And if you want to get like super nerdy and technical, amygdala activation that's heightened for a long time without kids being able to come down or enjoy the support of a relationship with an adult that helps them regulate. So this was a lot of the justification for early childhood programming, and following that justification, from scientists, from kind of seminal work such as From Neurons to Neighborhood. Following that, we saw federal legislation through the ACA program. We had early childhood programming, historical programming, such as Head Start, but we saw new programming that sort of really reflected a response to that brain development kind of research. And we saw the maternal, infant, and early childhood home visiting authorized by ACA. And that was from a lot of advocacy by scientists and researchers and practitioners about, so how can we sort of buffer early development and kind of build the capacity of parents and other caregivers to support child development, even if they themselves have experienced chronic stress. So kind of there was a little bit of a back and forth between federal policy and program, between sort of research and research that was really influential, kind of activism from a little bit lower, still a lot of hierarchy because we're talking about research, and then sort of federal programming and federal legislation that followed. And sort of we've seen that unfold. And I'm going to talk later about, a little bit more about how that policy evolved with us wanting to design these programs for children at risk, and then what happens if we're actually expelling the children who are most at risk from the program that was designed using their data and kind of leveraging information about their brain development and risk factors. So I'm going to save my comments about that for next, but it's been a fascinating kind of way of seeing early childhood policy evolve and kind of push back and change as a result of more attention to equity issues.
I think what for the next node of conversation, which is really the core of how do we partner and design policy with students, with families, and with educators. And it's not an easy question. It's not a simple question. Tamika's like, no, it's not. I saw that eyebrow. And I'm also linking it to something that Cynthia put in the chat box around the pace of change and the pace and who and how we organize for willingness for that change. And oftentimes, as we know, oftentimes when we hear young people speak up and speak out and speak to and speak for is when sometimes there is that shift moment. And so I'm curious if you can share, and this is really sharing stories of both celebration and challenge when it comes to designing student, educator, and family-centered policy. And actually, literally, what has that looked like? And as you're starting to think about that, I can prime you that one of my biggest learnings when we were in a youth and educator partnership training was this beautiful tension conversation where educators wanted to say trauma-informed policy. And young people said, we're not traumatized, stop saying we're traumatized and stop saying we're at risk. You are the ones who put us at risk. You are the ones who traumatize us. We want us to be called XYZ. We want us to be called leaders, champions, et cetera. And so I'm sharing a very small and high level example of the complexity of even language in policy, which signals partnership and who's being listened to and how we're talking about rather than talking with. That's a very long setup. So Tamika, I know you want to speak on this a little bit. How do we do this? What does it look like where you're at? And then I think Greg and Yasmina and maybe Kim too. What does it look like? And please put stories of celebration and challenge in the chat box as well.
I think in the area where we are, I think it's mainly, and just not just where we are, I think in general, it's about making connections. It's building rapport with your students, your staff, your community stakeholders. Is really getting everybody to buy in. Is that hard sometimes? Absolutely. It's not always peachy, but I think being consistent and making the effort to being present and voicing the importance of how, we need these type of policies or we need these type of protocols in place to make sure that our students are safe. I think that's the most important. What I have found in our district, one of our challenges have been pretty much low parental support. And I think in general, I think that has always been an issue in education overall. But just trying to make more efforts to educate parents when they don't know, they're not going to buy in. They're not going to chime in on what you're trying to market or sell to them because they may not even be aware of what you're trying to implement or what services that you are actually providing. And I think just making sure that you get everybody on board, including your board members, your stakeholders. You have to get out and make visits. You can't just send emails and just try to make a phone call. You have to make personable connections with people. And sometimes that's getting out of your comfort zone. You may have to get in your car and drive. You may have to do presentations. Whatever it takes to make those connections, I think has been the most beneficial. Sometimes in our situation, we have had to develop, for instance, our anti-bullying and harassment policy that was based off of seeing a consistent number of discipline referrals and having issues specific geared towards bullying. Now we have an anti-bullying and harassment policy that is included in our student handbook. So students have access to it where they can fill it out, the parents can fill it out. It's also available on our website. And since we have been doing that, and since we have been able to employ school social workers where they're going in and doing social emotional lessons and being more of support for those type of behaviors, I can say that we have seen a decrease. It has not completely gone away, but we have seen a decrease, and it's all about the connections. So building the rapport and making those connections and just having that communication link, I think has been a plus on the local level for us.
Yeah, Tamika, someone, just to pop in before other folks chime in, you know, someone said to me a couple years ago that adult policy focuses on behavior and student policy focuses on need. And that you'll see if you're actually doing a real scan or assessment of literal language, if it's focusing on the sunflowers, it's probably written by an adult. If it's focusing on why someone is needing to literally chew, to have something to somatically mull over, to have activation, then maybe also it's then a need that's not being met. So it asks us to actually really dig into, are we policying for behavior, or are we policying, and listen to that verb even in what it sounds like, for the need? Yeah, Greg, I know Yasmina also just put a rich golden nugget into the chat box that you can maybe speak on.
Well, I also think, Leora, what you just said really resonates with me when we talk about behavior being legislated through policy. And I think really easily we can all see that playing out with the public debate over mask mandates in schools. Because it's really, for some folks, it's really about a behavior and whether or not they can do it. And then there's other folks with like a public health approach to why that might be important in an education environment. But the link that I dropped in the chat, just, I don't want to take up too much time to read about it, but kids championed some legislation in Arizona that failed epically, couldn't even get a start. But because of their activism and because of their persistence, and the superintendent in Arizona took their concerns and formed a whole cross-sector working group, and we spent over a year creating what they had asked for. It never became formal law, it never became formal policy, but it just really resonated with me what Greg said earlier, that like within our own sphere of influence, we can take some of those things and pick them up and do them anyway.
When I think about this prompt, what comes up for me, and I'm just going to name a caveat first, and if people don't agree with me, that's okay. I don't mind the back and forth. But this question is rooted in a core belief that I have, that everything that is happening around policy and around who gets to make policy is steeped in an institutional design to reproduce white supremacy culture, which doesn't serve anyone, including white people. Like very few white people benefit fully from that. Like it harms everyone in the long run. So this isn't about necessarily just white people. It's about the harmful culture. So I want to just name that, because when we're talking about doing with planning with teachers, with students, with families, it's important to surface which families. When I was a principal, I was fired once. It only lasted 2 weeks. It was at a charter school, and my board cited that I was giving too much time and too much attention to our students of color. We were 98% students of color. Don't worry, I got my job back and all that, but the point is, we have to surface which folks, and this is where our definition of equity versus equality has to come into play. And if we're really going to do things with our communities, especially when there is a gap between the experiences of those who are in the schools and those those communities that we're serving, I believe that we need to make part of this work a reset of our mindset. And we have to really flip the script on the power and the sociopolitics of these relationships. When SFS first started, we were fortunate to get a 2-year grant to do a parent engagement project. And the idea wasn't to empower parents. The project was based on parents being empowered already and asking the hard question of our schools, whose children actually are these? And so we put together teams that needed to have at least 2 people as part of the teams of 5 or 6. And one of the people had to be the school leader, and another one had to be a parent liaison or a parent representative. And a criteria for these teams was that the parent liaison was the boss. The parent liaison drove the team's work and did not do the in-between work, didn't do the homework. They were the manager of that team. And the flipping of the script, the narratives that came out of this were powerful and beautiful. And I really think that we know lots of ways of engaging our communities, and it needs to include a flipping of our narrative, of our belief systems, of our paradigms, or else even these effective programs will just tweak back to the status quo.
Okay, so okay, yep. You already got us started on the red light, green light, yellow lights. So let's have a full conversation. So everyone, what is the please do not do, stop doing when it comes to student, family, and community partnership and co-designing policy? What is the please start doing? Or for me personally, the most important, what is the hold up, caution, yellow light? What are the questions that we need to sit with before we even start partnership engagement? So red light, green light, yellow light when it comes to actual design of policy. Red light, yellow light, green light.
I think it's important to understand your culture and what, what group of people that you're working with. And yes, you want everybody on board. Everybody's not going to buy in. Everybody's not going to be in agreement. But I think that, if you can come to a consensus of an overall goal, which is focusing on the students and your community as a whole, I think that is the most important element that you can ever present when you're talking about policy. But to just have a deep understanding of, like Gregory said, the diverse population that you're dealing with and the culture that you're trying to embrace, I think is going to be your most important element.
And I would just add that what produces the best policy, that being words written on a piece of paper, is the process of the community development around the conversation, because it is about developing community and then reflecting that in the written word. And so all of this conversation is critically important to what you wind up with. Somebody voting on and putting in writing.
Pamela, I think you're trying to say something. We can see that this is happening.
Toggling between so many screens here to see the chat box. Sorry about that. No, I think that, all of these examples that we just heard, including Mary Beth, it's so important. It's just sort of reminding me that it's so important to try to institutionalize family voice as best we can. And I hate even the word institutionalize because it's just making me think of so many hierarchies. But I think, so in early childhood, we have a really good example in Head Start, because there's a baked into the model and required by our federal program is a policy council that's comprised of parents. So parents have to have a say in budgetary and programmatic decisions at the level of the grantee. And that is direct federal to grantee. So these are often community-based organizations. And that it's just, I actually served on in DC, we have universal pre-K, and the way DC did that was through the Head Start grant. So it's community eligibility. So I actually am a person with lots of access to privilege, but I served on, my son was my kids both went through Head Start because they went to the local public school, and I served on the policy council, and it was just an amazing opportunity, the Head Start Policy Council. And it was an amazing opportunity to see how, families, there are some families for whom English was not the first language, who are able to be involved in the policy council. And it was the first time they had a voice, and they were so timid about sharing their voice initially, but they really, it was kind of a leadership building opportunity and a peer mentorship opportunity for those parents who are usually who never had an opportunity to be involved at this level in their child's education. And it's a way to start out, because these are young children. And I think that there in school districts we have various opportunities that are sometimes part of a program, a principal's budget committee, a PTA, a board of directors. Sometimes we have that, sometimes we don't. And we've just seen in the past year during the COVID-19 pandemic sort of what that looked like when, policies were made without taking into account the needs of working families, about whether there would be school or not, and whether there were school-age childcare options in local areas that were subsidized for the families who need it. I'll just say one more thing from the other side of the Zoom, from the parent perspective on the other side of the Zoom. It just broke my heart to know that some kids who are 8 and 9 were completely unsupervised at home while they were doing virtual learning, because parents had no choice and no say in whether there was school or other options for them. And in normal times, as somebody who's worked a lot in schools, that would be a child welfare issue. I don't think any teacher who knew about that, was seeing it as a child welfare issue during the pandemic, during virtual learning.
I had a director who always would make this saying, he said, I can drive the school bus, but I need people on to help me make some decisions. If you have a dictator who wants to write a policy, it's going to be a poor policy. And so you have to surround yourself with champions. For example, if you're working on a suicide prevention policy for the district, and you have a parent who lost their child by suicide, then that is your champion. And their voice is powerful and will be heard. So you got to surround yourself with, like Pamela said, people that are impacted by the policy itself. And so just remember that, it definitely would serve as a green light for developing policy.
Yeah, and Kim, probably the layer to add on to that too is to center lived experience and also not tokenize or manipulate lived experience at the same time, right? So we all know that creating policy with folks at the table is one thing, and then in implementation, which Yasmina will lead us through on Thursday, if families aren't continued to be partnered with, then it feels empty, and it can feel really violating oftentimes for families. But I think that what you brought up, Kim, is really necessary, especially around how do we center those who are feeling the most hurt as our nucleus, or as our focus, I'm watching my language equally, and also those who are doing the hurt. And part of what I want to move us into is the hard conversation. And I'm going to again remind us, like, the norm of agreeing and arguing and aspiring in this conversation around, it's one thing to design. And as I think it was, hold on, I'm going to scroll up so I can make sure that I say this. I think it was Danielle who also said that examining policy and amending, modifying, or actually saying dismantling in itself is part of restorative justice, that there is actually a beautiful invitation. And I want to hear from you about, what does it look like to say, this policy was in existence and no one was spoken to or with about it, and we need to actually use a policy review process as an apology, or use a policy design process as a way of saying we need to do right. And I'm thinking about the geographic diversity on this panel, and how there are cultural contexts that I'm hoping you can speak to when it comes to the trickiness of having hard conversations when it comes to examining policies that are injurious, and policies that are historical legacies of injury. So I'm going to open it to see if we can get a little bit, and hopefully a lot of it, into that conversation.
So Leora, I don't mind sharing, in Tennessee, we still have a corporal punishment law that's still on the books. And so when we kind of look at what that means for schools, I mean, teachers still can paddle, okay? And so we know historically that's been there for ages, okay? And we haven't really done anything to it. And sometimes it takes somebody being injured, unfortunately, or dying because of some things. And I remember an experience that I had with a person that was at Sunday school talking about his experience with paddling. And he said that, he got into some behavior problems, but he ended up being the kid that teachers practiced paddling on because he had so many. So they would pull him out of the classroom and into the hall, and a teacher would instruct, this is how you paddle. You make sure you get low on the butt, not up on the back, and I was like, oh my gosh, we've got to move away, to more of restorative justice and all of this. And it starts again. I mean, I can't go to the state and say, hey, you got to change this corporal punishment law, but it's about really educating our folks to understanding why this shouldn't be. And it is extremely, it's never brought back up in our legislation. But we've got to educate more people so that it's not a practice. It may be a law, but it's not a practice in the school building. And so that's how we can modify things to really educate folks on trauma-informed care.
So, Kim, oh, go ahead.
Go ahead, Greg.
Kim, if you can see my leg, it's bouncing up and down about 100 miles an hour right now. My heart is beating. I'm having a really strong emotional reaction to that reality, even though I've known it, exists, but to just hear it, I'm having a very strong reaction. And now I'm thinking about my son. He's 10 years old. We adopted him when he was 5. He was abandoned at 1 year in a park. He has PTSD, and every outburst, every single infraction of the last 5 years, except one, I can trace to him being triggered by something. And until we start recognizing that our children don't go to school trying to get under our skin, that our children go to school to have their basic needs met, and when they're not met, some are more equipped to respond than others. But whatever they do to respond is a reaction to us either meeting or not meeting their needs. Until we get to that reality, I don't believe we should be tweaking anything. I don't think, what was the verb you used? Modify. We should not be modifying anything. And I know some of us have to. This is where, even in my own work, I have to say, what work can I do? What work can't I do? And the work I can't do, someone else should be doing. So someone's going to be fighting at the ground level and saying, how do we work with these schools so that they can understand this is bad? I'm at the place where it needs to be interrupted. In other words, we have to start by stopping. At the very minimum, we've just got to stop. And if we can't because there's a law behind it, then that's the work that gets taken up, or whatnot. And that's not everybody's job. We can't ask classroom teachers, clinicians, practitioners to take up their state houses, etc. But someone's got to, because the harm that's happening is so overt. It's hard for me to live with knowing that it exists and thinking because it's not my child or because it's not me, we have a longer timeline than that child who is being used as, I don't even, I'm beside myself. Thank you for sharing that story. And it's, and I'm sorry, I won't be long, but my own son has been the face of that child in many, many situations where he goes in and they want to criminalize his reaction. And I asked them, what will it look like if I drop you in the ocean and you can't swim? What would your body look like? What would it feel like if I came to you and said, I don't mind saving you, I'll put you in the boat, but first you got to be still? Because that's what's going on to our children. That's exactly what's happening to our children. And so until we start asking the questions of what happened right before, and that's where the accountability starts. then we've got to at least interrupt. I'm struggling with the modifying piece.
Yeah. Yep. Well, hopefully you can live into the dismantle piece because I think that's where, and I'm queuing up Mary Beth, Laura, and Tamika because we're going to talk about how systems can start to align. But part of what, and Kim and I go way back, part of what we have talked about, and I think is getting lifted up, is that it's one thing to talk about being trauma-informed, creating trauma-informed policies, creating trauma-informed practices, and having corporal punishment still in the books. It's one thing to have an anti-bullying policy and also have policies that are deeply homophobic. So we have, right? So it's a thinking about, instead for us in policy design, they all live together because they're all impacting the same human being. And that is part of our invitation for this conversation, is to get out of, again, the policy and get into the human that is navigating the policy. So I want us to hold on to that complexity and to call us into accountability that we actually can't do both and. We can't have both on the books because they impact the same student. And with that said, I want to get to folks, and Pamela, I see your hand. So welcome you in. I want to get to what it takes to coordinate multiple systems. We saw someone in the chat box say, yes, okay, we're talking about school mental health and systems of care, which means getting folks in multiple systems who have different training and different language and maybe different perspectives on the same page, because they're all impacting, maybe hopefully serving one family, one community, or one student. So Tamika, you have beautiful experience with this. Mary Beth, Laura, thinking about what does this mean to do that kind of alignment or the struggles of alignment at the state.
I'll chime in a little bit. I think building a consensus across with your stakeholders, I think that's going to be difficult in some ways, but I think it's necessary. At the end of the day, no matter what policies we put in place, no matter what procedures we put in place, I go back to kind of what Gregory said. It's all about the mindset and it's about treating the human, and having compassion versus always trying to come up with a policy and follow it directly. At the end of the day, these are kids. I try to navigate the way that we teach, the way that we provide our services in regards to saying, if this was your loved one, if this was your child, treat these children as if they're your babies and not just present bodies in your classrooms. Because at the end of the day, empathy and showing these children that you care can be the most rewarding for some of these babies, and not just them, just, for us as the educators as well. A lot of these kids are not thinking about English, science, social study, and history. They're thinking about surviving and what they have to face when they go back home, and some of the traumas, that was even mentioned earlier. And I think having a broader perspective about that and more educating and having mutual agreements, mutual understanding, or MOUs, so to speak, with community stakeholders to say, hey, we need y'all on board with us as educators to say, this is what we need to provide for our students for them to be successful. If we're putting it in policy that we want them to be lifelong, lifelong learners, we can't just say it and put it on paper. We have to model it. We have to shadow it. We have to implement it, and we have to be consistent in every effort that we do. And sometimes it falls through the cracks. I've known policies to be in place for years and nobody really implemented. It's just on paper. So, we have to move from that and change the mindset and show compassion and empathy and understand that, when we're dealing with mental health, we're dealing with the whole child, academically, socially, behaviorally, and it's more than just a child sitting in the classroom, being instructed. And I think that you got to start from that basis is my opinion.
I couldn't agree more. I think one of the caution points that I would offer when it comes to making policy collaborative, certainly at a state level, is it can be very tempting for stakeholders to go to training on trauma and say, okay, yep, I'm aware, I am trauma sensitive, therefore our mission statement is trauma sensitive and everything is but the difference between being trauma sensitive, and then having your policies and practices actually be trauma informed, that's very different. That is making sure that we are walking the talk, right? That is the rubber hitting the road, and not just what it says on paper, but that we are actually doing what we subscribe to. You know, I think about, you know, Tamika was talking about the importance of engaging stakeholders and partnerships and relationships and rapport. And that's so key, right? We do that with students a lot when it comes to differentiating instruction. Universal design for learning, right? The affective network, the recognition and strategic network. Now we know best practice says that we need to address the affective network first, which is the engagement piece. So if we think back to Pamela's point before about the amygdala, right? And that's our emotional center. When you guys may have heard the term flipping your lid, right? When the amygdala is activated, our prefrontal cortex kind of goes dark. And that students can do that and that adults can do that. And you put that together. And general wisdom is someone loses in that quote unquote conversation, that there's very little restoration happening. And then going from being trauma sensitive to having policies and practices be trauma informed. And then from a clinical standpoint, making sure that services are trauma specific. That's really important. Again, just also throwing in here that there are 16 known categories of social determinants of mental health. And how we think about trauma is broader than the ACEs items, right? Like it has a lot to do with risk and protective factors. So the policies at both the macro and the micro levels really have to be reflective of, are we engaging the voice of the people that we're impacting? Right? Or are we inequitably including some and excluding others? One of the ways that we address this in New York Aware, specifically one of our subgrantees has a student member of the advisory council, and also a high school senior was trained in youth mental health first aid as a trainer. So you have students being trained as trainers, very powerful, builds their own capacity. Gregory, before I think you said there's a difference between people being empowered versus coming into the knowledge that they've always been empowered, right? And so giving students and families those opportunities to participate at various levels related to policy, that's key.
I'm so grateful for that, Laura. And oh, Pamela, go ahead. Yep, I see. Nope. Yep.
Sorry, Laura, you're speaking my language when you talk about making a limbic system. I was actually going to make one more comment in response to Greg. Like, so right, one of the reasons why I left working on policy with a big P with federal colleagues, and I'm back down doing clinical work and trying to learn from you all little p policy, is because I really think that one way to work on this is at the level of the classroom with teachers. I mean, in schools, we're so focused on the prefrontal cortex and what can I learn, that we're forgetting the underlying questions. Am I safe, which is the brainstem, and am I loved, which is the limbic system where the amygdala is housed. So, you know, it is, we have so much research supporting these approaches, but I couldn't figure out how to communicate that to the big P people. So I'm back working on an individual level, on kind of from the inside on these, you know, working on these systems that have traumatized and re-traumatized our kids by helping teachers change their approach and their trauma-informed approaches, but it's brain-based teaching. That is kind of, I just see that as a real kind of a potential place for change, and it's on a much smaller scale than what I originally thought I should do.
Yeah, and I think, Pamela, what you're bringing up, and I'm cueing us because we're going to move into our last question. I'm going to invite folks who are listening in to also do some reflection. What you're also offering is that, again, back to our original sentence offering, is that it's not about the what often, it's about the how. And so if we're writing legislation and policy about trauma-informed XYZ without the process being trauma-informed, then there needs to be a little bit of a check, right? A little bit of a whoop, rewind. And at most basic, it's how are we doing this work power with versus power over, right? And where is their consent in the process so that folks don't feel like things are happening to them rather than things are happening with them, which is what I think the teaching that Tamika and many folks have brought into this conversation. Taking a breath and watching our time, I'm curious if we can do a rapid round, and I'm going to put the order in the chat. So Yasmina, Tamika, Laura, Maribeth, Kim, Pamela, ending on Greg. Rapid of advice to folks who are just beginning this work, in this work now. This is the one thing that I want to offer you to walk away with into the ether world of Zoom. The one thing. So it could be a sentence or, as Greg often does, a question to help us drive our practice. So Yasmina, Tamika, Laura, Maribeth, Kim, Pamela.
I would say if this is your first year, I would spend the entire year figuring out precisely what is my sphere of influence. And that will set the foundation for everything that comes next. But policy change requires relationships with the people who, with a really, really, really small number of people who can move the lever. And it takes about a year to figure out even who those folks might be and what your sphere of influence is above. And I guess, Fran, I can, but I'd like to, she had a question in the chat box, but I would give everyone a chance to answer this question. I can circle back to it.
I would say if you were new to the system, I think it's really important to just make connections, try to establish those rapport relationships, like I was saying. I think it's also pertinent to really think about sometimes you have to start small and making those small changes and small approaches to get bigger results. You may not be able to change everything all at once. You may not be able to change the mindset of everybody, but just focusing on the importance of, you know, those kids and their needs, and how it can benefit to have everybody working as a team with collaborative efforts. You know, you can show how it will reap benefits in the end. And I think that's the main thing, you know, just starting off with those connections, you know, consistency, communication. And I think just taking those smaller approaches, you know, in order to have those larger gains.
And I think my advice would be get to really loving onions, because to do policy work, big P, little p layers, you are going to uncover them, guaranteed. I'm not a betting woman, but with this I would be. But when we talk about policy, we're literally talking about systems change, practice change, programs, data, right? All of it. And so it's kind of like if something is worth doing, it's worth sustaining. And if you're trying to sustain something, the policy is going to help you sustain it. So how are you going to leverage your stakeholders, your resources, the capacity, infrastructure, to make sure that every layer you're peeling back gets policy closer to what our students and families need. So definitely get to learn, you know, learn to love onions, and then it's not any misstep, that it's all part of policy, big P, little p, and just my own ask. I implore you, please don't do what's easy with policy, do what's needed. Thanks.
Wow. And I'll follow that by saying that all I wanted to really say is that any policy that doesn't consider the sameness of each of us as humans of different sizes and different levels of development, is probably worthless. I mean, that has to really be behind any good policy.
And I'll add to that. I just ended up changing a policy recently that was from 1999. And for me to be able to understand what's out there, I really need to get my hands dirty in it. So I need to look at those policies that affect me. And then those that really are archaic, like this one was on social services, that really asks the principal to do everything a social service person is to do, which is not possible. To really find champions that want to help you change that. And again, it's about not so much top down, but sometimes it's bottom up, that we take those policies, those amendments to the school board and let them understand the reason why we are even thinking about changing those.
These are really well said. I think my advice to anyone who wants to do this policy and advocacy work would be to, if you want to remove, or if you want to advocate for removing some of these harmful, damaging kind of policies and practices that Gregory has been talking about and that Kim gave these examples, you have to also advocate for alternative restorative practices. We would not have had in 2014 when there was a federal policy statement on reducing and eliminating expulsions and suspensions in early care and education settings unless we had, alternative approaches such as early childhood mental health consultation for teachers, such as positive behavioral support. Unless we had those articulated in the same statement, there's no way we could have just said, take this away, you're not allowed to do it anymore, unless we're providing teachers support and building a toolkit for alternative approaches and making sure that there are resources and that there's a budget to support the development of the restorative practices that are an alternative.
All right, Greg, short and sweet. How does that?
Challenge me to ask a question. So I'll start with two questions. One, what is it that gives you courage? And how committed are you to transformation? Because this work will require transformation, not just of our policies, but of us. And so my advice would be, start with yourself and stay with yourself. That unless we're committed to the continuous inside out work of our own transformation, we will become a mechanism for the status quo. And so, and if I could push one policy specifically to take up, can we get it to the place where our credentialing of any professional requires them to have the skill to foster healing before they get the job, and it not become an afterthought once someone has the job? So that's where I would leave us.
Okay. I just took a big breath. I hope other folks are doing that as well. I want to do a couple things as we semicolon, because the reminder is that this was part A. There's a whole other panel coming up in an hour with the same questions and different incredible sources and fountains of wisdom. So if you want a policy nerd with us, take a walk for an hour and come back. I want to put the Google Doc in the chat box that can help you process your learning. There have been so many big things named that maybe activated your body, your soul, your ancestors that you do the work for that are channeling through you. They were like, yes, listen to that, whatever it is. We want to make sure that you have a way to process. And I want to close by inviting everyone in the learning to put into the chat box one takeaway, one thing you heard that you want to go to your rooftop and yell out to the world, that you want to bumper sticker your car on, that you want to make sure your laptop has right in front of it, that you will put on your Zoom name. I'm Leora, moderator, and all corporal state punishment in law, she, hers. Whatever it is, one takeaway in the chat box. And I also hope that you join me in deeply thanking this incredible group of humans who just met for the first time 90 minutes ago and really embodied what it looks like to be in collegial, not just congenial, but collegial discourse. So As you transition out, I'm hoping that your takeaway, your gateway ticket, your, what am I saying? Exit ticket. Got it, Laura. I saw you. I could hear the class. Your exit ticket is to put in one takeaway, just like Yasmina did. What produces the policy is the process of development. I'm going to invite for panelists if you can stay on for about 5 minutes afterwards. Terry is taking away persistence and patience. Greg is taking away always do with those most impacted by policy. Diana is leaving with a question: how do we avoid tweaking back to the status quo? This will not be easy, but so important. So remember, how will you be courageous? And who do you need to be courageous for? Beautiful. And again, saying thank you. Carrie is reminding me that I always neglect to remind folks to hopefully fill out a survey, and we'll send it to you in a follow-up. Bridget is saying so many things are mental health policy. SPED is policy, educator retention is policy. Yes, Bridget, yes, oh, yes. Whoever is listening to the recording, I just made a really awkward body movement. Pamela is saying it is our collective responsibility to ensure that our policies prevent harm and undo harm that has been inflicted by our systems and schools. Accountability and persistence is Tamika. Thank you all so much. To those of you who are going to stay with it or who are going to come back in an hour, a reminder that all recordings and our learning capture will be in your hands shortly, as soon as possible. We're really grateful for this time and this really rich conversation. Thank you all so much.